What if doctors could look inside your body without making a single incision? What if they could detect a tumor, track its growth, or see whether cancer treatment is working, all without surgery? It may sound like science fiction, but it's something doctors do every day using powerful imaging technologies. So today, we're uncovering the fascinating world of cancer imaging tests. This includes CAT scans, MRI scans, PET scans, and ultrasound. What are they? How do they work? And why does each one play a critical role in the fight against cancer? Stay with me because understanding these tests could help take the fear out of the unknown. Welcome to Everything About Cancer with Doc Fred Ting.
New episode every Wednesday.
And Saturday.
Hi everyone, I'm Doc Fred Ting, your medical oncologist, academician, researcher, and health system shaper. And welcome to Everything About Cancer, kung saan tinatanggal natin ang takot sa pamamagitan ng tamang kaalaman. Let's dive into one of the most important tools that we doctors use in cancer care: imaging tests. When doctors suspect cancer or need to monitor a patient's condition, imaging tests helps us see what's happening inside the body. Think of these tests as different types of cameras. Each one captures unique information that helps doctors make important decisions. Let's start with a CT scan. A CT scan, or a CAT scan, uses X-rays and computer technology to create detailed cross-sectional images of the body. Imagine slicing a loaf of bread and looking at each slice individually. That's similar to how a CT scan allows doctors to examine organs, tissues, and tumors layer by layer. CAT scans are often used to detect cancer, determine tumor size, and check whether the cancer has spread. MRI, or magnetic resonance imaging scans. Unlike CT scans, MRI uses powerful magnets and radio waves instead of X-rays. MRI provides highly detailed images of soft tissues such as the brain, spinal cord, muscles, liver, and other organs. Because of its excellent image quality, MRI is especially useful when doctors need a closer look at certain areas of the body. The machine can be noisy and the scan may take longer, but it provides valuable information that other tests may not reveal. PET scan, or positron emission tomography scans. Now let's talk about one of the most advanced imaging tools. A PET scan doesn't show what the body looks like, it shows how the body is functioning. Before the scan, a small amount of radioactive tracer is injected into the bloodstream. Cancer cells often use more energy than normal cells, causing them to absorb more of the tracer. Now, during the scan, these active areas appear as bright spots. So PET scans help doctors identify cancer activity, determine whether treatment is working, and detect cancer that may have spread. So ang pagkakaiba po ng PET scan sa CT scan, ang CT scan ay mapapakita ang bukol, but ang PET scan ay masasabi or masasuggest sa doktor kung yung bukol na yan ay may active na cancer cell o peklat na lang ba yan, no? Inactive na yung cancer cell. Ultrasound. Ultrasound uses sound waves to create images of structures inside the body. Many people associate ultrasound with pregnancy, but it's also widely used in cancer diagnosis. Ultrasound can help detect lumps, evaluate organs, and guide biopsy procedures. It's painless, does not use radiation, and can often be performed quickly in an outpatient setting. So why don't doctors just use one imaging test for everything? Well, simply because each test provides different information. CAT scans are excellent for detailed body images. MRI scans provide superior soft tissue detail. PET scans reveal cellular activity and metabolism. Ultrasound offers real-time imaging and guidance for procedures. But when combined, these tools help doctors get the most complete picture possible, leading to a more accurate diagnosis and personalized treatment plans. If you've ever felt nervous about undergoing an imaging test, remember this. These scans are more than machines. They are powerful tools that help doctors find answers, create treatment plans, and monitor progress. Every image captured is another step towards understanding, healing, and hope. Modern medicine continues to advance, giving patients and families more information and more options than ever before. Knowledge empowers action, and action creates possibilities. Thank you for watching. If you found this video helpful, please like, subscribe, and share it with others. Stay informed, stay proactive, and remember, every journey toward better health begins with understanding, and every step forward is a reason to keep believing. As always, let your faith be stronger than your fears, because cancer is not a death sentence and there is always hope. Thank you for watching Everything About Cancer with me, Doc Fred Ting. If you found this episode helpful, please like this video, share it with your family and friends, and subscribe to the channel so we can spread accurate and reliable information about cancer to more people. Don't forget to click the notification bell so you won't miss our upcoming episodes. And always remember, let your faith be stronger than your fears, because cancer is not a death sentence and there is always hope. Again, I'm Doc Fred Ting, and see you in the next episode of Everything About Cancer. Welcome to Everything About Cancer with Doc Fred Ting.
New episode every Wednesday.
On Saturday.